Shivani, I've just finished your checkup, and based on the information that you gave me, about this sudden breathing difficulty you had today morning, it seems that you have got a condition known as adult-onset asthma. So, it is a kind of asthma that is generally seen in adulthood. What are your thoughts on this?
Asthma, because I've only heard that young children get this
Absolutely.
asthma. Like me at this age, I thought it wasn't a condition that at my age people would get.
Yeah, so there are basically two types of asthma. One that you said is seen in childhood, it is known as childhood asthma, and the other form of asthma it can occur in the adulthood as well, and therefore it is known as adult onset asthma.
Oh, okay.
So don't worry, I'll give you more information about it. But before we move forward, I'd like to know how much you know about this condition.
Nothing much really. Just that something to do with breathing
Yeah.
problems.
Yeah. Okay. So now I'll explain it to you in detail. Asthma is a condition of your airways, and it happens due to allergy.
Okay.
So what happens is due to certain allergens, your airways become swollen and narrow. As a result, the air cannot pass in and out smoothly. That leads to the breathing difficulty.
Okay.
Right? So the common symptoms people with asthma can have is breathing difficulty, and in severe form of asthma, it can have a significant impact on their day-to-day routine because this breathing difficulty can lead to tiredness and other symptoms as well.
Oh,
However, this condition is generally manageable.
okay.
So it is not very serious. Don't worry about it.
Okay.
Now, the common reasons why people get asthma can be several. First of all, it can occur due to some factors in the environment, like very cold weather, or during the spring season when there are a lot of pollens in the environment. People tend to get these kind of attacks. Another possible reason could be the family history. So, if anyone in the family has asthma, the other family members are more prone to get this condition.
Okay.
Can you think of any of these reasons in your case?
As far as I know, nobody in the family has this condition. But I do recall now that you are saying that this breathing difficulty is a little more during the cold. It feels worse even more during cold.
See, okay. So this can be the possible reason why you get this attack.
Possibly,
Yeah.
yeah.
Okay. Now I'm going to explain how we are going to manage this condition. So at the core of asthma treatment is the blue inhaler. Have you seen people using inhaler?
I think I have. Yeah.
Yeah. So it looks like a pump. Yeah, and it has medicine in it, which is known as salbutamol.
Okay.
Now, what this medicine does is it relaxes your airway by relaxing the muscles of the airway. Therefore, the breathing, issues that you are experiencing resolve after taking this medication because it widens up the airway.
Okay.
What are your thoughts on using this inhaler?
I really don't like the idea of taking this inhaler as of now because, as you know, I'm 38, and I feel that if I start taking this now, I might have to take for the rest of my life.
Okay, so I can see that you are not very happy about the idea of taking regular medication.
Yeah.
Isn't it? Right. Now, let me assure you that this medication is very safe and the side effects are very few.
Okay.
So, even if somebody is taking it on a regular basis, it is not likely to cause any harmful effects on your body.
Okay.
Another reason why you should consider using this medicine is it is the most effective form of treatment for asthma.
Okay.
The reason behind that is because we are not actually injecting any medicine in your veins. It is just a topical medication that goes directly into your lungs. So it is less likely to have effects on your other vital organs. It is just being pumped into the lungs.
Oh. Okay.
So it is safer as compared to any other form of medications.
Okay.
And about the habit formation, if you use it wisely when it is absolutely necessary, then it is not likely to cause any habit formation as well.
All right.
Now, let me know if you have any other concerns about what I have just explained.
No, I do understand this. Maybe how do I use this?
Sure. So I'll explain you how to use it. See, this is the inhaler, and this is called spacer. So you actually need to put this inhaler into the spacer while using it. The first thing you need to do is the shake inhaler. Like shaking makes sure that all the medicine is mixed really well. Right? Otherwise, the particles tend to settle down at the bottom of the vial. So make sure you shake it before using it.
Okay.
Second thing is you should be using it always with this spacer, not directly into your mouth.
Okay.
Third, before you take this inhaler, you should take a deep breath out. Exhale all the airs that is filled in your lungs. Okay. And then take the medicine.
Okay.
So when you start taking the inhaler, the first thing you need to do is put this spacer in your mouth. Try to hold it tight with your lips and not with your teeth.
Okay.
And then you have to do two things simultaneously. On one hand, you have to press this pump so the medicine goes in, and at the same time, you need to take a really deep breath.
Okay.
So the medicine can go as down as possible into the lungs and can have a very good impact.
Okay.
Right? Finally, after you have taken this medication, wait for 20 minutes to see how effective it is. Generally, within 20 minutes, your breathing difficulties should resolve.
Okay.
Now, I know this is a lot of information to take in. Let me know what questions does that leave you in.
Although I'm clear with the instructions, but I'm still a little worried because the thing that I experienced this morning, it was so bad. I just felt as if I'm going to die. And also, I have heard that people are actually dying of asthma.
Okay. Yeah. So, indeed, having a sudden attack of asthma can be frightening, and you might definitely would have heard about people dying. But there are two factors to consider here, right? The first concern about people dying due to asthma, let me assure you that it is not that common. Like hardly 0.1% people would die because of asthma, and not because of asthma itself, but because they have several other conditions, making it complicated for us to treat asthma.
Okay.
So generally, in 99.99% of cases, asthma is manageable with medication.
Okay.
I hope that's reassuring enough.
Actually, yeah, I feel a little better.
Yeah. So if you will be following all the suggestions that I have given, it would be really possible for us to manage it without having any complications at all.
Yeah.
So next, I'll be giving you suggestions on what to look for when you get this kind of attack and when you should be seeing the doctor.
Okay.
So, as I explained earlier, as and when you get this attack, you should be taking this inhaler, wait for 20 minutes. But if you notice that your symptoms do not improve even after 20 minutes, try to take another dose of medication.
Okay.
Right? Wait for another 10 minutes. And if the symptoms do not resolve, if you feel that you are not able to catch your breaths, then you should rush to the doctor immediately.
Okay.
Nothing very serious. It is just that they might give you some medications in the veins that would help you relieve breathing difficulty.
Okay.
Right? Do you think you can do that?
Yeah, I'll certainly try and take care of it.
Okay. Now, before we wrap up, is there anything else you would like to ask?
No, Priya, thank you. I think all my questions are answered.
Okay. So, what I would like you to do next is keep a diary of your symptoms. So, whenever you get this attack, once everything is managed, note down the whole episode in your diary. What were you doing when it happened? How long did it last? Okay. How many puffs you had to take to relieve the medication and how you felt after the attack.
Okay.
So, when we meet after 15 days, I will be reviewing all the episodes, all the notes that you have. And based on that, we'll be able to determine further treatment.
Got
for
it.
you.
Yeah.
Right? Now, can you just summarize for me what all things you need to be careful about?
I think I should be taking the inhaler.
Yeah.
Also, I should be maintaining a diary, especially I need to write down the episode when it is happening.
Yeah.
So, and how many puffs I took. So, I
Yes.
think I'm okay.
Okay. So
Yeah,
I'll see you after 15 minutes then.
right.
So, Shivani, I have seen Pooja and the rash she's having as well. But before we come to the conclusion, I would like to ask a few more questions. Is that okay?
Yeah, absolutely.
So, how has her mood been lately?
She has been feeling quite lethargic of late.
Mhm. And is she sleeping well?
No, she doesn't really sleep well at all. You know, because of the rashes that she has,
Mhm.
they are very itchy and she gets really irritated. So she can't sleep well.
Okay. And has she been eating regularly?
No, actually not. She doesn't feel like eating anything.
I see. Okay. So, you mentioned that she has this fever and rash for about 3 days now, and that has also affected kind of her sleep and her eating pattern and everything, right? So, based on the information that you have given and the examination I did, this rash looks very typical of chickenpox. Have you ever heard about this condition?
Yeah, I do have a little idea about it, but it would be more helpful if you can explain a little bit.
Sure, yeah. So chickenpox is a viral condition. And because of a viral infection, children tend to develop this rash on the
Okay.
skin, and it can also cause symptoms like lethargy, effect on their appetite, and the mood disturbance. Right? Now, this is generally very mild disease until the age of 13. If someone is getting it after the age of 13, it can be more severe. But because she's just 6, okay, at this stage it is not very severe. So rest assured about that. And this recovers generally very quickly in about 2 to 3 weeks' time.
Okay.
So we are not dealing with anything serious at the moment.
Okay.
Now let me know if this leaves you with any concerns.
I am a bit confused. I have heard various versions from people, but if you could just tell me, is it contagious or like, as in, can I send her to school?
I see. Okay. So, yeah, you are quite right that this can be, spread to other people as well, since it is a viral infection. So it tends to spread from one person to other person, especially in the first 1 week of the
Okay.
disease, until they have this spots and the rash. So once this rash tend to develop scabs, the thick skin on it, then it becomes less contagious.
Okay.
So I believe at least for next 1 week, she should be staying at home,
Okay.
and you should try to minimize contact with her for that 1 week, initial 1 week. Oh, because it can spread to other people as well.
Oh.
Right? And in terms of overall recovery, as I explained earlier, if we take proper care, then within 2 to 3 weeks, she will be completely out of this. So it is not anything major as such. Now, do you have any other questions apart from this?
Yeah, like you just said that she should be isolated.
Yeah.
So, like, I also have a 10-month-old son. He's at home at the moment. So I'm afraid even he has chances of catching it.
So I can see, Shivani, that you are worried about your younger child catching this infection. Now, you're quite right here that, there is a possibility that he might get this infection since it has been already 3 days
Yeah.
and he might, would have come into contact with her by now.
Yeah.
But again, let me assure you that this condition is not going to be very severe for him as well, because at young age they generally tend to develop a very mild form of disease.
Okay.
Right? So just like Pooja, he also will have a normal recovery if at all he develops this. So you really have to be watchful. If he develops any of these symptoms, then we might need to start treatment for him as well. But again, it will not be very serious form of disease. He will be recovering very soon with the mild condition.
And like, should I come back to consult you? Like, if he catches this?
Yes, definitely. So you have to watch for the rashes or for the fever. And if he develops any of these symptoms, then we might need to consider the same treatment that we are giving to Pooja at the moment. So you should come and talk to us about this, and we'll be starting the medication.
Okay.
For him as well.
Okay.
Now, let me give you suggestions on what care you should be taking at home for Pooja. You should make sure that she is well hydrated.
Okay.
Right? Because the virus can be easily flushed out with a lot of water intake.
Okay.
And it is absolutely necessary for you to watch out for any symptoms of dehydration, such as if her, eyes are shrunken, if her skin, has a lot of like kind of wrinkles on it. So these are the symptoms that she has developed dehydration.
Okay.
And in that case, you should bring her back to us. We might need to give some IV fluids to her in that case.
Oh, okay.
Right. Apart from that, you should watch for any redness or pus formation around the rashes.
Right.
Right. If you see the rashes are swollen, red, or if there is any pus formation, or if she complains of pain at the rash, then that would possibly indicate some form of infection. And in that case, we might need to give her some antibiotics as well. Okay. So that is another reason, why you should be bringing her back to us. Okay. Now, I know this is a lot of information to take in. Let me know if you have any questions at this stage.
Another thing I was wondering, like, because her rashes are already so itchy, and she, as a child, does not understand that she's not supposed to scratch there. So, if you can just help me, how do I, like, help her to not scratch that area?
Sure. Okay. So I'll be giving you some of the ways through which you can manage the itching. Right. The first thing you can do is with the clothing. Give her cotton clothes, right? And with light colors of clothes. And they should not be very tight. They should not be sticking to her skin. So this will make sure that the rashes are not irritated and she will not have much of itching because of this.
Okay.
Another useful thing that can be done is to apply a calamine lotion on it. Okay. It will keep the rashes moist and will reduce the itching.
Okay.
Finally, I'll be sending you to the pharmacist who will be giving you some medications that reduce allergy and irritation on the skin.
Okay.
So if the previous two measures are not helpful in relieving the itching, you might consider giving this medication to her, especially at night, so that she can sleep well.
Yeah.
Okay. So I hope these measures will be helpful in managing her condition. If you have any other concerns, you can definitely come back to us.
Sure.